So I guess this week has been another interesting week for us in South Australia, another week of zero. But if we look across the international scene, by the time last week I said that the Friday had been the worst day, I was already out of date because that Sunday was the worst day across the world. And we've still got many places where things are getting worse rather than getting better. So we're going to have a bit of a look at what's going on around the world and then drill into what's going on in South Australia. So that list of names there, that's the list of countries in the last 3 days have averaged at least 1,000 new cases per day. So a few countries there which you glance at that and think, ooh, that country's health system's probably not going to manage 1,000 extra people every day. And you sort of look across, and then down in the bottom corner there, over the last 3 days, the USA's had 130,000 more cases, and you can read the rest of them for yourself. And so you can see that if we look around the world, there's still a lot of places where this is getting worse. And as I said last week, the World Health Organization has declared that coronavirus is still accelerating. And in fact, last week, 1.2 million more cases. And worldwide, we're past 10 million. And it wasn't that long ago, we're only scraping into the 1 million. And deaths have passed 500,000. And for Australia, last week wasn't particularly good. And in fact, so far today, there's another 53 cases have been found. I looked at my phone a few minutes ago. And so you actually see what's going around the world, and you can see on those charts, the worldwide chart, that little peak, 187,000, and then yesterday was above that again, scraping closer to 200. And for Australia, if you add today's numbers in, that chart's going back up as well. And I guess what we're looking at there is, what does that mean for us? And there's been some more talk this week about whether a case is overseas acquired, whether it's been locally acquired, whether it's community transmission. What do these terms all mean? Well, if a case has been overseas acquired, then certainly for Australia that means that every single one of those people has been found during their time in hotel quarantine. So they're very low risk for that to be spread out to other people. If you look at cases that are locally acquired, then what they're describing is that from tracing from people who they know have the illness, they're finding somebody else with the illness. And again, there's not that much chance of that getting totally out of control if you're down at low numbers. But if you're talking about community transmission, they're the people who've got no idea where that's come from. And the more people we have who are catching this from community transmission, the more difficult it is to control it. And for us in Australia, and I guess if we're looking at Victoria, which is a place where there is still community transmission in Australia, if they're down still in the couple of team, like 15, 20, 25 people who they're tracing, then you can do that really well. If you're trying to trace 100 people in a day, that's really difficult. And so there's a limit at which you can still keep a lid on this. And that's why we're watching very closely the next week or so what happens. Which brings us down to, at the individual level, how do we control this? Well, the government's taking care of the quarantining of arrivals, and now we know that if you're put into hotel quarantine, you actually will have to have a test. I mean, that was a surprise to me that I thought that was always happening, that everyone who ended up in hotel quarantine had to be tested on release, but apparently that wasn't the case. It is now. The next one is testing everyone. And so the story remains really the same. And unfortunately for us adults, or actually probably fortunately, it's probably about 1 every 3 months you catch an illness. For kids, and I know some of you have got young kids, it's really nice here today to hear some young kids making some noise. If you've got young kids, it's about 1 a month. And at this time of year, that averages out about 1 every 2 weeks. So that means that we're going to be having lots and lots and lots of swabs. If we want to make sure this doesn't get away from us, that's really the idea. Testing and tracing. That's the next point is contact tracing. When you're sick, regardless of what it is, if you stay away from people, you're not part of the problem. And the last bit there is protecting ourselves, which is the cough. You've probably heard before there was a cough. That was me coughing into my elbow, clearing my voice, making sure I could speak. And if all of us cough into our elbow, if we turn away from people when we cough, if we run away if we're going to sneeze, then we're making sure we're not adding to the problem. So for South Australia, as of midnight tonight, we're into stage 3 of a roadmap to recovery. where they've changed it from being 1 per 4 square metres to 1 per 2 square metres, which is really good for us. And the physical distancing principle, the 1.5 metres, they've actually clarified that a little bit more as well. And if there are people you regularly associate with, you can actually get within 1.5 metres of those people. And I guess when we're looking at that contact tracing process, that if you're around somebody quite often, then you're already at high risk, so you may as well clump in together. If you're not, we don't want to increase the number of people who you are a risk to or who are a risk to you. And that obviously opens up quite a lot of things. And for us here at Woodcroft, we're still trying to tease out how we do that and still maintain an access point and contact with people who can't be here. Because there are still quite a lot of people who, if I was the doctor being asked what they should do, there is quite a lot of people who should still be being very careful and who probably shouldn't be here. And so we need to be able to manage both things at once. And really that last point again there, you notice it's on quite a few of these slides, is stay home if you're unwell, because we don't need that spreading through, whether it's here or anywhere else. We don't want that coming through for us. And the last slide, and Darren's tip, thank you again, Pastor Chris, is let's spread the good news. So there's been again this week a lot of discussion about, well, Victoria's doing the wrong thing and how come it's Victoria, etc. Could have been here, could have been somewhere else. And in fact, this week it's almost certainly South Australia will not be zero, because there's at least 300 people flying in from, I think it's India, and some of those people are almost certainly going to have the virus. So let's spread good news. Let's make sure we're positive about things. Let's look at Proverbs here, Proverbs chapter 25. As cold waters to a thirsty soul, so is good news from a far country. So we like hearing stories of things going well, but particularly if you're a Spirit-filled Christian, you like hearing stories about baptisms and people being Spirit-filled. And today, if you're somebody who's listening to this for the first time, or if you're somebody who's haven't been watching because it's been able to be watched over the internet rather than have to actually come here, and you're hearing these things, and we'd like to actually offer you the chance to learn more about the good news as well. I'd like to thank everyone for listening.